Hello, my name's Heather and I work for TEAMHealth in aged care. So my job title is a support worker and I work with the elderly in their own homes to help to maintain their independence. We take them to medical appointments, shopping, social outings, we have a coffee, and they really enjoy that because a lot of them don't have families here. So for them to come out, to get out for the day, they just think it's just wonderful. To be a support worker in aged care, you have to have patience, care about people, honesty. You've got to be honest with them. Very organised because it's different every day. You know, one day's never the same. You're here, there, and you're transporting them. So we go into the homes and we help assist the elderly. A lot of them don't have families, and they don't drive, so they have to, they need help. So we take them to medical appointments, do a domestic clean, and also a social. It's good for them really because it gives them independence, you know, to live in their own home. So by having a service that come in and prompt them with their medication and you know, take them out on socials, you know, they really enjoy it. And a lot of them don't want to go to the homes. A lot of them have their own houses that they've lived in there for many, many years, you know. So to sort of, you know, pack them all up, it's a bit, you know, devastating to them. A lot of the cases when they come home from hospital, you know, they're all very weak. A lot of them, you know, forget to eat. So we do go in and prompt food and prepare food as well, yeah. Some participants we only service, you know, like twice a week. Sometimes we have every day. You know, it all depends on what level of care they have and what they require. We do a lot of the northern suburbs, but now we're starting to branch out to Palmerston, Bees Creek and Humpty Doo. Yeah, but we are actually looking down the track to go to Bachelor. It's not a hard job, but it's common sense job. You know, so you really got to stop and think. If you arrive at someone's place and, you know, they're just not the same as what you normally see them. So then you've got to assess them to make sure that, you know, have you missed anything? Is there something happening with you today? Because quite a few of them, you know, can have a stroke. We're not medical, but when you work with them for so long, you get to know them, you know their symptoms, you know if they're not well or, you know, or if they've had a stroke, you know, because we do a lot of first aid training, so we have to look for signs. To work in this job, yes, you need a certificate. Certificate 3 in aged care, and I've also got Certificate 3 in community service as well. They're just so grateful to have the help. They always say, you know, thank you, you know, for taking me shopping or to the medical appointments, you know, cleaning the house. It's a great help for them. It's the most rewarding job that I can think of. I couldn't, you know, like I couldn't think of doing anything else other than the job that I have now. Yep, love it.